Here is your question. Right, so if you have read and understood, considering it surgical anatomy station, kindly tell me which bone are you looking at? What are you looking at, please?
I am looking at the internal surface of the base of the skull.
Okay, how would you describe this for me?
The base of the skull can be divided into anterior cranial fossa, middle cranial fossa, and posterior cranial fossa.
How would you divide them? What is the demarcation line? Yes.
Okay, the middle cranial fossa is
in other words, can you please,
yes,
sorry for interrupting you. In other words, can you tell me the boundaries of the anterior cranial fossa first, please?
Okay, the boundaries of the anterior cranial fossa includes the frontal bone, and then it's bounded posterior on both sides by the sphenoid and the temporal bone posteriorly.
Okay, which bones form the anterior cranial fossa?
That's it includes the frontal bone. It also includes the ethmoidal bone.
Okay.
That forms the anterior cranial fossa. Then the middle cranial fossa includes the sphenoid bone and then the two temporal bones. It is bonded anteriorly, anterolaterally by the lesser wings of the sphenoid, and then anteromedially by the limbus of the sphenoid bone.
Okay, can you please move on and tell me the boundaries of the middle cranial fossa, please?
Okay, the boundaries of the middle cranial fossa includes, it has anterior boundaries and then posterior boundaries. The anterior boundaries on the medial side, on the lateral side, includes the lesser wing of the sphenoid bone. Then medially, it is bounded, anteromedially is bounded by the limbus of the sphenoid bone.
Yes.
Then posteriorly, on the lateral side, it is bounded by the superior part of the petrous, superior part of the petrous part of the temporal bone.
Yes.
And then posteriorly, it is bounded by the dorsum sella of the sphenoid bone.
And the floor is formed by the
floor is formed by the body and the greater wing of the sphenoid. And the squamous, I think the squamous part of the temporal bone.
What are the bones which are involved in the formation of the middle cranial fossa? Two bones?
The bones which are two bones, that's the sphenoid and the two temporal bones.
Okay, can you please tell me the contents of the middle cranial fossa, please?
The middle cranial fossa includes the pituitary gland, and the two lateral portions accommodate the temporal lobes of the brain.
Yes, very good. Okay, now if we can move on to the identification part, can you please identify this 44?
Okay, 44 is foramen lacerum.
It's actually trigeminal impression. Okay.
Okay, if you can, trigeminal impression.
Right. If you can identify this 45, please.
45.
Tuberculum cell. Okay.
Tuberculum cell.
We'll ask more common ones. If you can identify this number 12.
Okay, number 12 is foramen ovale.
Yes, what passes through it? Can you please tell me?
The contents that passes through it is done by ovale. which includes the optic ganglion, the mandibular division of the trigeminal nerve, the accessory meningeal artery, the lesser petrosal nerve, and then the emissary vein from the pterygoid sinus to the cavernous sinus.
Very good. Okay. Can you identify superior orbital fissure?
Superior.
Or you can tell me which one is foramen magnum?
Okay, foramen magnum is number 11.
Yes. What else passes through it?
Okay, foramen magnum, the contents of the foramen magnum includes tissues, nerves, and vessels. The tissues that passes through it includes the temporal membranes,
Yes.
and then the apical ligament of the dens for the
Okay.
cervical vertebra. Then
Yes.
the nerves that pass through it includes the spinal division of the accessory nerve.
Yes.
Then the medulla oblongata, the lower end.
Yes. And
Then the
vessels?
vessels include the vertebral arteries and then the anterior and posterior spinal arteries.
Okay, very good. Can you please tell me the bones of the skull? They have which these bones, these sutures, at what age do they fuse?
Okay, they fuse at 17 to 18 years.
Completely, but they start fusing or ossification between the age of 18 to 24 months.
Okay, yes, okay, thank you, ma'am.
Okay, if you can tell me what type of joints there is between two skull bones.
Okay, it's a syndesmosis.
And what type of joint is that?
I'll say it's
okay. Right.
I will get
Then
back
you
to that
can,
question.
all right, okay. Can you please tell me what are the muscles which are attached at the styloid process? Can you see styloid process here? No.
No, I can't, but I know the muscles
Where
that
would
are
it
attached
where
to
would it be attached? Where would it be found?
Okay, it will be found close to the stylomastoid
Yes.
foramen, which is on the external part of the skull, not on the interior part.
Yes. So if you know, can you please tell me the muscles attachment?
Okay, the muscles that are attached to it include the stylohyoid, the styloglossus, the stylopharyngeus muscle.
Okay, good. Can you please also tell me, it's more common that the cancer, when it metastasizes distally, it metastasizes to the skull bones. What type of lesions are present or can be found on the skull bones?
Okay, we can have primary lesions in the skull, and
Yes,
then we can also have metastasis in the skull.
Yes. Can you name
lytic
skull
skeletal
lesions?
metastasis?
Yes, and then those which distantly.
Okay, the lytic.
Yes.
The lytic skull lesions include from the metastasis likely could be from the multiple myeloma, Paget's disease, sarcoidosis, osteomyelitis, and then from hemangiomas,
etc. Okay, right. Can you quickly tell me the contents of the posterior cranial fossa?
The contents of the it includes the contents include the contents of the posterior cranial fossa includes I'm coming. It includes the brainstem, and the cerebellum.
Yes. Okay. One last question, because what is Clivus? Clivus.
Okay. Clivus is an important part of the skull. I think it's I couldn't make it out from the diagram.
No, it's you can't see it here, but what type of growth plate is present there, if you can remember?
For the Clivus.
Yeah, the question that they can ask is
the Clivus. Yes, the Clivus is a tract. Is a tract for the it can be a tract for the cranial nerve 6. That's the abducent nerve.
Okay, Then the joint or the growth plate, that's hyaline cartilage that is present there.
Okay,
And-
highline
Yeah.
cartilage.
Okay.
Then it is
Yes. Right.
first pheno-occipital
Yes.
syndrosis with the
At what age? Can you remember? Can you recall? In girls and boys,
it starts
it's
at
different?
about yes, in girls it starts earlier at about 12
Earlier.
to 13 years, but in boys it starts later at about 14
Yes.
to 15
If
years.
you can quickly remember, like with the age of puberty, so that's how it is. Right. Since this was just the foci of skull, so I have not asked you dural venous sinuses and all those other things that could have been asked. And I have asked you skull foraminas as well. Roughly, they'll point and they'll ask you different to identify different foraminas, and they'll ask you their contents. So I have asked you randomly. That means, and you've told me you've answered them correctly. So I assume you know them all. Thank you.
Thank you, ma'am. Thank you,
Good.
ma'am.
Good.
Thank you, ma'am.